How's everybody doing? My name is Dr. Jean-Paul Bohemier. I work out in Calgary, Alberta, Canada, and I practice a procedure that not a lot of people know about called NUCCA. I frequently get asked questions by other professionals and from people that are seeking out this care, what makes NUCCA different than maybe what they've received in the past or what they've had tried. And so I'll explain a bit about that in this video and try to make it as quick as I can. The NUCCA procedure focuses on an area of the head and neck called the craniocervical junction. That's basically right where your head meets your neck. And this is an important area because it's one of the most mobile areas of your spine. So the majority of the rotation, flexion, extension in your neck occur at that spot. And when you have a lot of mobility in an area, it makes it more susceptible to injury. So as we go throughout our lives, and we have falls, we have accidents, we try to learn how to ride bikes, and in Canada we have lots of winter, so we have slips and falls and tobogganing and skiing. All these things can lead to a situation where you can actually create damage in the area and create a misalignment of your upper neck. If that sits there for a long period of time, then what happens is you can get neck pain, headaches, migraines as a result of something that occurred many years ago. And most people never get this area of their head and neck checked. So the NUCCA procedure, when we start looking at this area of the head and neck, the thing that we do is we take some specific x-rays of the head and neck, we analyze those mathematically to try to see, okay, how are you shaped? How does your geometry work? And what's the most appropriate way to correct it? And based off of the information we get from those x-rays, that allows us to determine a specific vector or angle from which we deliver the treatment. And then the adjustment itself is extremely gentle. It feels like a little bit of pressure behind your ear. So most people, when they're getting it done the first time, it doesn't feel like much is happening. But what we do is we recheck it afterwards. We take some x-rays to see, did we in fact get that correction? And is it leading to a positive change in that individual, or do we have to adapt our approach? And as a result of the specificity of this treatment, we find that we don't really have to see people very often. As we get them more imbalanced with the way they're designed to be, they just tend to hold their alignment fairly well, and then they feel pretty good. So fortunately for us, we tend to have great success with people with migraines and dizziness and complicated neck problems. So if you're someone who's looking to try out this treatment or understand a little bit more about it, please feel free to give me a call at my office, and I'd be happy to talk with you in private about any concerns that you might have, especially if you're in the Calgary area. If you're someone outside of the Calgary area, feel free to send us an email, and we would do our best to find somebody locally for you that can help you out. Anyway, I just wanted to thank you for taking the time today to learn a little bit more about how the NUCCA procedure works. And yeah, I look forward to talking to you, and I'm sure the information will be at the bottom of this video once we post it live. Talk to you soon.